So is it home care or home health? And even though they sound almost exactly alike, they are different. And in this video, I want to help you understand the difference between home health and home care. And if you stick around to the end, I would share with you a little known process. You can get home care paid for or get it for free. Welcome, my name is Vitaly with inHom Senior Care. I'm so glad you're here. And so what is home care, or what's the difference between home care and home health? So kind of from a larger perspective, they both help seniors stay at home, but they serve very different needs. So what is home health? Think of medical care or skilled care. So things like nursing, physical therapy, occupational therapy, wound care. They are higher skilled needs. Somebody's going to come over and do some therapy and provide that care and that assistance. So they are ordered by a doctor, right? And they are covered, these services are covered by Medicare or other insurance, but most of the time we're talking about Medicare. So anytime something is covered by Medicare, it is going to have to be ordered by a doctor. Visits are limited to an episode that is tied to recovery. So something happens, maybe some person had a fall and then they had a hospital stay, and as they're potentially discharging, they will have therapy available to them to be able to continue to progress in their recovery to the point that they can function back in their own environment. So for example, occupational therapy would help somebody relearn their routine, like climbing up the stairs or getting in and out of a bathtub or getting onto the toilet, getting in and out of bed. Some of those things that all of us take for granted because we're in good health. So think of an episode, right, and limited amount of time. It is not ongoing. It is not something that just continues into perpetuity. So that's home health. So then what is home care? Home care, think of it as non-medical support at home. So help with activities of daily living, helping with getting dressed, with bathing, helping to prepare and plan meals, light housekeeping, changing linens, doing laundry. You get it, like a little bit of everything around the home that a service may come in and provide for somebody to make sure that they can function well in their own environment. So rather than short intermittent visits for a specific therapy, this is flexible, meaning that a family could hire a home care company to provide just a few hours a week, all the way up to 24-hour care to make sure that someone was there to help with whatever those needs are. Home care is usually private pay. So families will pay out of pocket to continue to allow somebody to stay where they are, right? Because it's no different than like assisted living, where you're going to pay for rent, you're going to pay for a package of care, and then maybe you're going to pay for meals. In this case, you're going to pay for care in your own home, right where you are, right? And so let me just take a moment there, because there's a misconception out there that everybody ends up in some sort of a facility at some point. The truth of the matter is, anywhere you go or anywhere you receive care is a choice that you will make, and receiving that care at home is just as valid as moving into a facility and receiving that care there. And in your own home, it's going to be customized specifically to you, and it's going to be on your terms, and obviously in the space that you are in, which is your home, which for a lot of people, for most Americans that we hear in terms of surveys and such, that is their desire, is to age in their own home. So again, think of home care as ongoing support wherever it is that you call home, with whatever those details of that support. So that care plan may be something, today that 3 months from now might look a little different. There might be some additional tasks that are added to it because as the person is either progressing and getting better and not needing as much care, or they're declining and needing additional assistance that is going to be provided. So again, so the key differences are skilled or medical versus non-medical. So skilled would be the home health, and the non-medical would be home care. And then the other key difference is short-term. It's based on an episode of some sort. So it's meant to just come in, help somebody get to a level of operation, and then they pull back, right? Because the government is paying, Medicare is paying, insurance is paying, and they're not going to pay in perpetuity. They're saying, we're going to do this, but once you reach a certain level, this is done. And then the home care option, it's up to you. It can be ongoing. And as I've mentioned in other videos, we've had many, many families who we've had an amazing privilege to work with for more than 10 years, to be able to provide that care at different levels with, different intervals of visits throughout the week, all the way up to 24-hour care when somebody needed that. But it's very flexible. It can be flexed up or flexed down based on those needs. And then again, another differentiation is it's visit driven for the skilled side, or for the home health side, which would be, the nursing visit might be only for 15 minutes because that's the nurse is going to check the wound and everything is okay and she can go. Or it could be a half hour of therapy, or it could be 45 minutes of therapy. It's not based on time, it's based on a visit. And so somebody that's a little bit more nimble can get through those exercises quicker. That visit might be shorter, and somebody who's really maybe even having a hard day that day, that visit may end up being longer. So it isn't based on time, it's based on that visit. And on the home care side, those shifts or those visits are based on a time frame that the family is requesting. So very common is a 4-hour visit. And so it might include helping somebody with getting up out of bed, and then getting their morning hygiene routine assisted with, and then helping them get dressed, preparing a meal, being with, and then helping to clean up and doing some of those kinds of things. So it will include all of that, including maybe we need to go to a doctor's appointment. And so that might be on the schedule for that day as we get the person ready and we're going to take them. So again, those are differences. One more kind of differentiation is that the home health is a treatment visit. It's meant to treat a very specific one thing. And then on the home care side, it's daily living support, right? Maybe it's not 7 days a week if the person doesn't need that yet, but it's somebody showing up, a caregiver is coming to support that person in all sorts of different ways to help them make sure they can still stay there and be independent. So which one do you need? So if you're recovering from surgery, if you're in an episode of some kind, you would need home health. And so as you're coming home, the discharge planning office or the social work office might help you to set up home health visits to make sure that as you come back into your own home, you can get some extra therapy, or if there is a wound that's healing, that a nurse might follow. And then if you're looking for ongoing support, right, even if it's a little bit of support just to provide some maintenance care, then you're looking at home care. And then many families will end up using both. And I think, again, why there's sometimes confusion, because you can easily see, we use this company, I'm not sure why we now use this company, and why one company won't do all these things. And so part of that is just because they employ different types of professionals. Here on the home health side, you've got nurses and PTs and OTs and people who are very skilled. That's why it's called skilled services. And they're coming in for a quick therapy visit, and they're on to the next patient. And then on the home care side, you've got somebody who is your dedicated caregiver, who has a relationship with you, is coming in and providing that care one-on-one, making sure that they're meeting all of your needs. So some common misconceptions are Medicare covers home care, right? Like, well, I have Medicare, it should pay for my home care. So again, Medicare, home health is a Medicare benefit. So somebody, as long as they've had that hospital stay and those requirements are met, they will have home health that will follow them. But home care, or that daily support, is not covered by Medicare. So, and then home health stays as long as I need it. In other words, I could just have a therapist with me from now on until I pass away, or for the next 2 years, or for the next 2 months. So that's not true. So Medicare will pay for skilled care as long as the person receiving the care is making progress and improving, right? So as let's say it's physical therapy, and as the person is continuing to gain their strength and progress, those visits will continue. But as soon as that person plateaus and they are not making any more progress, part of the rules for Medicare is that signals the end of that episode, and that care is done and it's pulled away. All right, so hopefully that explains it and helps you to better understand what the differences are and why the healthcare landscape has lots of companies, and we all refer to one another because we serve people differently, right? And we each provide value. And I would argue that the best companies are the ones that actually specialize, where they do one and not everything, where they may focus on home health and that's their piece, and they've got fantastic skilled professionals working for them. And then the companies that do what we do, which is the non-medical daily assistance, the home care side, we're really good at that because we're focused on the type of people we hire, on how we train them, and how we supervise and oversee that whole process. So, all right, so I promised that I would share with you how you could get free care. And so what I wanted to share really quick on that side of it is that if you're a veteran or a spouse of a veteran, you have home care service benefits available to you. And so the VA will not necessarily advertise or reach out to any given vet at any given point and say, hey, just so you know, all these services are available to you, right? It just doesn't work that way. You will have to be your own advocate. Your family, those closest to you will have to act as an advocate for you to be able to make sure that you figure out what it is that you have available and that you have access to it. So if you need help with that process, please give us a call. We will be happy to sit down with you, work with you, and help you to figure out how to connect to the VA and walk you through that process, because it is a bit complex. And then please leave a comment or ask questions. If you'd like to see a video on a specific topic that we don't have yet, I'd love to entertain that. Please leave a comment and let us know how we can help you. So thank you for watching, and please share with your friends. Till next time.